I frequently meet nurses that have come from a different healthcare system that is primarily using paper protocols. So I explain it to them that the traditional paper protocol that they've become accustomed to is a linear type of way to manage insulin drips. We're looking at what is the blood sugar right now. And in their experience, and they can usually validate this, when the blood sugar is in target, they're instructed on the paper protocol to turn the drip off. And then I ask them, well, what's the half-life of IV insulin? And usually they look at me with a blank face, and I tell them it's 6 minutes. So 12 minutes after you've turned that drip off, where's the blood sugar going? Right back up. So the glucomander has the ability to factor in so much more than just what is the patient's blood sugar right now.
The great thing about it, the feedback that I've gotten from nursing staff members, is that it's real time, it's dynamic. It's not that they're measuring against a static number. The patient's A1C, the patient's meal, there's a number of factors that are automatically built in so that it's appropriate response and that it's that real-time glucose management.
Paper protocols you leave room for error with paper protocols, and I think that's the main thing there, because you have to manually calculate how much you need to adjust the insulin. You leave room for error there, whereas with glucomander, it's telling us what that patient should have, and it's telling us when we should check the next blood glucose so that it's safe.
When we were able to work with a product that was integrated within our medical record, our electronic medical record, if the patient has orders for an IV insulin drip, the nurse opens that patient's chart in the electronic medical record. There's a glucomander icon in the MAR, in the medication record part of their chart, and they click on it. It auto-populates with all the demographic information. They enter the piece that's individualized based on the physician order, and they're ready to go as long as they've got their insulin and their pump and the equipment that they need. So it's been tremendous. It's been a huge time saver, and the nurses are really digging it. Actually, we were in the ICU talking with the nurses and seeing the tool in action. The particular nurse, and not staged, not prepped in any way, gave a completely unsolicited response and said, I wouldn't consider working anywhere where they didn't have the glucomander in use.
In comparison with the paper protocol, it's really easier. But I think patient safety really is, the goal. And I think with glucomander, knowing what this patient needs as far as how much insulin the patient will need to manage that blood sugar is definitely safer, as opposed to us manually calculating.
Instead of continuing to chase their blood sugar for several more days, our average time to target here at the hospital is 6 hours. So we can get them into target. We can use all of that data to adequately assess how much insulin they're going to need subcutaneously, and we do a much nicer job. It improves our length of stay, it improves our patient outcomes, and the ease of use is, of course, the big selling point.
I would want my family member in a hospital where they were managed, where they had glucose control, tight IV insulin management, and I would want them to be in a hospital where I knew the nurses were using a tool such as glucomander to provide safer care, because I know that their management would be more appropriate.
Well, the way that we treat patients in the hospital has changed dramatically over the years, even, during my career. And there's a lot of emphasis on getting patients out of the hospital faster and keeping them out of the hospital. We have great concerns with length of stay and readmission rates. So if they have diabetes and we have a way to get their blood sugars controlled quicker, safer, longer, we're going to get them out of the hospital sooner. They won't be readmitted with infections or slow healing wounds, because we know the role that diabetes management plays in those instances. So I think paying attention to diabetes and using a tool like the glucomander is going to be safer for the patient. It's going to be cost saving for the hospital. And I can't imagine what healthcare professional or healthcare administrator, would argue with that.